Thanks, everyone.
Whenever you give me.
Good to go, Maria. Go ahead and kick start, I think.
Wonderful. Good morning, good afternoon, good evening for all of you joining us this afternoon. This afternoon in Geneva, for some of you, it might be early in the morning or very late in the evening. Thank you so much for attending this, what we think is a very important webinar session, which is part of a series that we would like to have around the WHO Clean Air and Energy for Health. Some of you have attended the conference, the global conference on air pollution and health in Cartagena de Indias in Colombia. So the purpose of this webinar, the main mission will be to make sure that we don't lose the commitments that were made in Cartagena, that we keep the momentum and we ensure that this momentum will be translated into very strong and tangible action. And for that, we need to maybe remember why we are here and why we are so committed to ensure action on climate change, on air pollution and health. And is because air pollution is the largest environmental health risk globally, responsible, as you know, of 7 million premature deaths each year, which is a horrible number that we all need to commit in order to reduce it, representing as well the fact that most of the people around the world is breathing air that is exceed WHO's air quality guidelines levels. And of course, we need to recognize that this terrible public health challenge is particularly important for the people and hitting particularly the low and middle income countries. So therefore, the most vulnerable populations. You will hear later by Heather more about the second global conference on pollution and health, with over 700 participants in more than 100 countries, and most importantly, with very strong commitments that you will hear about it very, very soon. In addition to that, only a couple of weeks ago at the World Health Assembly, a very important document was endorsed, approved by the countries, adopted, a roadmap, a WHO World Health Assembly 78 updated roadmap on air pollution and health. And the idea is very simple, but at the same time, very tangible and strong. We want to make sure that we move from the commitments to action. And for that, we want to hear from different perspectives, from a country perspective, from an international cooperation perspective, from cities perspective, from all the partners that have been so fundamental in putting this together. We want to hear from them. How are they moving to reach this voluntary target of halving the health impacts of air pollution by 2040? For some of you, this must be a very ambitious target. As a public health officer, allow me to say that is the minimum we can do to protect people's health, to reduce mortality, and to make sure that we move in the right direction. So we want all of you to define together as a community with different sectors, different engaged participants and partners to make sure that we have a clear path for the health sector where we can influence, where we can make sure that there will be ambition and clear targets for all of us to deliver. You are experts, leaders, advocates, scientists, and we need to ensure that we will all collaborate. We need to make sure that we will share progress, learning from each other, maintaining the level of ambition, and of course, learning as well from the challenges that we are facing at the moment when you are working at the country level. So I thank you once again and very warmly to all of those supporters, partners that made us reach this point on having the conference and the program that we have, and allowing us to reach this point. And from here, making sure that we will implement the roadmap and reaching this target as a minimum. From there, we can go even for more. So thanks again for participating. I see a big number of colleagues and partners and interested people participating, and I'm sure it will be a very successful webinar. Let me then pass it over to Heather Adai Rohani. She's the coordinator of the head of unit of air pollution and health and energy, the World Health Organization at Interim. And Heather will make a presentation, but don't worry, it will be short and sharp. Heather, over to you. Thank you. We can hear you, Heather.
Thank you, Maria. Indeed, wonderful, and thank you all for joining. Good evening, good morning, good afternoon to many of you around the world. I do have the pleasure of sharing with you all some little next steps and summarizing some of the great things that happened at the conference and on the World Health Assembly updated roadmap. Next slide, please. So as highlighted by Maria, we'll touch on the roadmap, we'll go into the conference, catch some highlights on that. And then what's most important, we really want to hear about countries and partners and how they are advancing on their commitment to clean air. So we'll hear from Colombia, the United Kingdom, the European Commission, as well as C40, our partners there. And then we'll have a wrap up from our great leadership team in the PAHO, Pan American Health Organization as well. Next slide, please. So the first, what I want to start with is actually give you guys a sense about this updated roadmap for a global response to the adverse health effects of air pollution. This is a very important landmark activity that happened this past, I guess, in February and May this year, and it really is a really important milestone where ministries of health really committed to advancing clean air and really made sure that air pollution remains the key risk factor and that the health sector is going to take this upon themselves to move forward. Next slide. So a really quick history. So the first ever resolution. So first of all, the World Health Assembly is where the ministers of health from all the different member states of the World Health Organization meet annually to discuss various policies that come out with resolutions where there's agreement to work in actions for member states to move forward on particular public health issues. So, in the first time ever, back in 2015, the first and only resolution on air pollution and health was passed unanimously. In this resolution, it provides specific activities that both member states and that of the Secretariat, WHO, should do to achieve clean air for all and to protect health. And following that, within the roadmap, within the resolution itself, it called for the establishment of a roadmap. This roadmap was presented the following year to the World Health Assembly, which again outlined key activities in a very concrete manner for the health sector to do to achieve those particular higher level mandates put forward in the resolution. This roadmap itself expired, and hence we have been updating it as a secretariat, and that's what has been passed and put forward at the executive board in the end of January, beginning of February, and was passed in May. I'm going to give you a little more details about that. Next slide, please. So just so you know what it is that the member states have agreed to do, which is a really great opportunity to really have key actions by all public health authorities throughout the globe, is to take specific actions in 4 key areas. The first area, we have knowledge and evidence. So that's where we really provide key suggestions and activities that the health sector can play. Back for the earlier slide, please. Where we provide key actions and activities related to the knowledge and evidence. So this is where the WHO Secretariat works with experts and researchers to really gather and synthesize the evidence and translate that into actions that can be done by the health sector and other sectors to achieve clean air for all and protect public health. A next particular category that's addressed within the roadmap itself is the measuring progress. Countries and cities and all sorts of authorities need to know where we're starting at in terms of the exposure to air pollution and the health impacts it causes, and what are the effectiveness of interventions. So this particular category really outlines specific activities that the health sector can do and use to measure progress, know where they are, know where they need to go, and see how the pathway is going on the way to get there. The next category we have is the institutional capacity strengthening. The health sector is a very trusted voice, but we need to make sure that that voice is knowledgeable about the exposure and the health risk from air pollution. And more importantly, what are the solutions that individuals, the community, or the governments can take to protect health from air pollution? What are some of those interventions, and how can they evaluate and make a very provide key evidence to critical decision-making processes, both within the health sector but outside the health sector, as many of the sources of air pollution that we need to be attacking are actually falling outside the mandate of the health sector itself. So therefore, we need to be, as the health sector, providing that evidence and information. And then again, the final section and category that is covered in the roadmap, where we provide actions and outcomes, is the global leadership and coordination. As I noted before, the health sector is a very trusted voice in the community. Nobody is a nice common denominator for various different sectors to work together. People are not going to argue that they don't want to protect the health of humans. Hence, there's a really important role that the health sector can play in terms of convening different actors, providing that evidence and that science to really drive interventions, and to really make sure that there's the political will and drive to continue concerted action to tackle air pollution. Air pollution is truly a collective problem that requires collective action, and we need to leverage the voice of the health community to move that forward. Next slide, please. In the roadmap itself, I mentioned we have these 4 categories, and here's just an example. Within each category, we have an annex, and with each category, we provide specific, very specific actions, and then resulting outputs and outcomes expected from these various actions. This is our key steps that basically outlines the outline key steps that the health sector can play with the support of the Secretariat to really achieve the clean air that we really aim to have. Next slide. Another very new key feature about this roadmap, which we're really excited and was in response to member states' requests, is that we've proposed a voluntary target. And this target aims, as noted earlier before, is a 50% reduction in health impacts from anthropogenic sources of air pollution by 2040. This is an ambitious goal, particularly for some countries. In some cases, it will be, well, actually, in most places, it's an ambitious goal. And we really hope that this will drive and set an agenda and a target for countries to move forward to. It's also very important that this target itself is really relative. It's a nice relative target so that the countries themselves can start in their own place and make the progress needed in their own particular local context. Also, this target really highlights the importance of the anthropogenic sources. Anthropogenic sources, or those man-made sources, are where we as a community can really take action and address the health risks. So this, therefore, again, creates a level playing field for those places that have a lot of natural desert dust and other natural sources of air pollution. This will help them to really be able to track their progress and demonstrate their own actions towards improving the air pollution that they have control over, and basically those that are man-made. And indeed, these are all relative to 2015 baseline values. We as a Secretariat did some backwards modeling and forward modeling to make sure that this was something reasonable that countries could meet. And we do think, although it's ambitious, it is something that is very attainable and to really make this a healthier world for all. Next slide, please. So in the end, this roadmap was put forward. We consulted with member states over the last, 18 months, and there was resounding support for the roadmap itself. It was passed. It was suggested to be adopted at the Executive Board back at the beginning of February and put forward to the World Health Assembly. And at this World Health Assembly, it was discussed with a lot of positive responses and appreciation from member states about the information it provides and the target that was put forward. Next slide, please. So now let's go so this roadmap was a very instrumental milestone and towards achieving clean air for all. So that's one key milestone. The second key milestone that we've had here at WHO in this drive to really ensure clean air for all was the second WHO conference on air pollution and health. Next slide, please. So this next slide is this is a video that does a quick kind of little sneak peek of what happened at the conference. It shows some of the great highlights that we had and gives you a sense of the feel of what that conference was and the energy and the enthusiasm and the support for really driving clean air. So let's have a quick look. Over to you, Turn.
Estos 3 días estamos organizando la segunda conferencia global sobre contaminación de aire y salud. Tenemos aquí en Cartagena 750 participantes que han querido sumarse a este esfuerzo de acelerar esta acción.
This meeting is about one thing. Air pollution is killing us.
Es de un trabajo muy fuerte, intersectorial, no solamente desde el Ministerio de Ambiente, el Ministerio de Salud, sino también con los ministerios de Energía, Transporte y sobre todo las autoridades territoriales en los departamentos, los municipios de los países y acá en Colombia, para poder implementar intervenciones que están basadas en evidencia que van a tener un efecto en mejorar la calidad del aire y evitar estos impactos en la salud.
But breathing is the most fundamental right that we all deserve. Try not breathing for 2 minutes and see what happens to you. There are always excuses. People don't want to give up their cars, they don't want to use buses, they don't want to stop cooking indoors, or they don't want to stop wood burning. That is not true.
La selva amazónica, ustedes saben que es uno de los pilares climáticos del mundo. Si se acaba esa selva, llegamos a un punto de no retorno, no para la población colombiana, sino para toda la humanidad.
Porque aunque parezca contraintuitivo, no todos respiramos el mismo aire.
We need to leave this room or this wonderful auditorium with progress, with ambition, with commitment, and definitely very much decided to change completely this massacre that air pollution is representing for our population.
Wonderful. Thank you. So that was a nice little video and it's available online if you all are interested in seeing it, but it helps capture a bit of the spirit as mentioned from the conference itself. Now, before really diving a bit further into the conference commitments and what we're doing in the follow-up is a big thank you to the partners. First of all, to the government of Colombia for their great co-hosting with the World Health Organization and our partners in the Pan American Health Organization. They were also great co-organizers with us. We'd also like to give a big thanks to many of the other supporters, such as Spain, the NORAD, Norwegian government, Netherlands, Ministry of Foreign Affairs, France, as well as other UN organizations, the Clean Air Fund, Bloomberg Philanthropies, Wellcome Trust, all of these, World Bank, all these partners were there and really made this a successful conference. It is a collective problem for collective actions, and this was a true demonstration of the commitment of all these different stakeholders to advancing clean air for all. Next slide, please. So, at a quick glance, Maria alluded to a bit of these cool stats in her intro. First, there were over 30 sessions over the 3 days of the conference itself, in the main, both in plenary and in parallel sessions. So many different key topics were covered, although we could have gone on for days as there are many different issues related to air quality and trying to protect health from it. Then in addition, on the margins, we had 26 side events and pre and post conference events with UN partners, civil society organizations. So it was really an opportunity to bring different actors together. These side events were all organized and led by other agencies, and they really took the opportunity of bringing all these people together to take advantage of this opportunity of sharing experiences, sharing knowledge, and advancing the clean air agenda. And as noted, we had on average 700 participants, and at one point, even when the president was there, we had a kindly made some remarks during the conference. We had over 1,000 people participating, and with a representation of over 100 different countries, of participants from 100 different countries. So it was truly global in nature, with a lot of high-level support with a variety of different actors. Next slide, please. Now, as you can see, there were many different commitments. We had commitments from governments like the Chinese government, the Colombians, the Brazilian governments. We had commitments from cities. As you can see, we have the Deputy Mayor of London there. We had commitments for civil society organizations, researchers, academics. All were really committing and pledging their support in trying to work towards achieving this 50% reduction in health impacts from air pollution by 2040. Next slide. But I want to flag something here. Have you guys noticed there's a bit of a commonality? We have managed to ensure that these target, the 50% reduction in health impacts from air pollution by 2040, was the same as in the roadmap that member states and ministries of health have committed to via the World Health Assembly updated roadmap for the health sector response. So indeed, we have member states have all signed on to achieving this 50% reduction, this voluntary target. And then we also have all those conference participants pledging their support towards achieving this target. Because indeed, it will take a variety and a number of people, the most people we can get to achieve this target. I'd like to highlight the pledge is still open, and we're really hoping that additional people, cities, civil society organizations, member states, experts, researchers will sign up to really advance this, this pledge even further. We're keeping it open till September 7th, the Blue Sky Days, so we can announce the big movement that we have across the globe towards clean air for public health protection. Next slide, please. So to make sure that we're making progress towards this target, and one of the another key activities that we are doing at WHO is we want to really make sure that we're monitoring health sector progress towards health sector's commitments towards achieving this pledge and this target. So we're going to be really monitoring various processes and various indicators in policy, governance, and finance to make sure we have the institutions behind this work and really moving things forward, which is like looking at health impacts, looking about decision-making, looking about human capacity. We're going to look at institutional capacity to make sure we're making sure that those health professionals are educated, they're knowledgeable, that we set up the surveillance systems as needed, that we are using health impact assessment to evaluate and implement policies in the health and other sectors to reduce air pollution and protect health. And then we want to make sure that the health sector is able to maintain this leadership and advocacy role. Make sure that we're making sure that air pollution remains on the political agenda. Make sure it's integrated into the high-level political declaration on non-communicable diseases happening in the UN General Assembly. Make sure that it's in the high-level political forum. Make sure it's in COP30. So we're really really working to make sure that the health sector is really on board to making sure we continue to elevate this message. We're going to be working with other UN partners to monitor their progress in these various areas as well. So we have ongoing discussions with United Environment Program, World Meteorological Organization, World Bank, etc., to make sure that we can really achieve and monitor progress and ensure that we're accountable for achieving this target. Next slide. So we want to make sure that we are monitoring these commitments. As I said, we had over 50 stakeholders, including countries, cities, and donors, civil society organizations, academic institutions, make commitments to achieve and to make progress towards achieving this target at 50%. And we want to make sure that we're all accountable for that. Next slide. In addition to the conference, we heard the voices of the health sector. In the run-up to the conference, we were gathering the collective voices of medical and health professionals, and through a various urgent call to action, we had more than 47 million voices from the health community represented on this call to action, which was delivered to the conference itself. Next slide, please. This call to action itself really aims to help ensure that the health sector is raising awareness about the health effects of air pollution, continues to build momentum for clean air commitments to decision makers, and lead by example to showcase the leadership role of the health community to show that we really feel that air pollution is a health issue. It is a health issue that we can protect and we can prevent the health risks associated with exposure. Next slide, please. So some next key steps for WHO in the follow-up to the conference and the roadmap. With the roadmap itself, we're working with our regional offices and country offices to disseminate and adapt their own local, regional, global map, their own regional roadmap to make sure that what we put forward at the global level can be adapted to the regional context. We're working to disseminate information products, tools, and resources to make sure that we can continue this evidence-based action. We have continued to integrate air pollution and health agenda into other global initiatives. As I mentioned before, the UN General Assembly's high-level meeting on NCDs. We want to make sure that air quality and health is included in the NDCs for COP30 and beyond. And we want to make sure it continues to be integrated into other global and regional initiatives. We're also going to be continuing to make sure that our healthcare professionals continue to strengthen their capacity to speak to air pollution, speak to patients, speak to the community, speak in decision making about what are the health risks and what are the solutions to addressing associated with air pollution. And finally, we're going to continue monitoring, as I said, and ensure accountability framework for these commitments that are being made on towards this pledge through cooperations with UN agencies and partners. Next step. Next slide. So indeed, there's an urgent need for this integrated tracking mechanism so that countries and cities and other organizations can see where they're at and see what progress they're making and versus sectoral policies, see where some of the finance is going. What are we doing about early warning systems, air quality management, etc.? So a number of various areas for integrated tracking is going forward, and will continue to work with other UN partners in making sure that we have a kind of a one-stop shop for knowing where we are with air pollution and health and where we need to go. Next slide, please. So just a last little flag here for some really cool, key, fun things that are happening in these next coming weeks, months from WHO. Next, on the 25th of June, we'll be launching the next SDG 7 Tracking Progress Report, which provides new statistics on household air pollution exposure and access to clean cooking and other energy-related issues. We have the science and policy summaries that are being launched, one's in two phases. One's mid-July on the sectoral solutions for air pollution and health. And then right into the run-up of Clean Air Day on 4th of September, we'll be launching those science and policy summaries related to specifically the health risks associated with air pollution exposure, and with a highlight of vulnerable populations and other specific health risks that are, yes. And then we'll also have a new joint report on coming out in cooperation with UNICEF on children's health and air pollution. And finally, and it's already available, we have a new set of infographics and videos about clean air, energy access, and health. They're available now, and we really encourage you all to download, and really, we need your voices. We need you all out on social media, sending the word about the importance of clean air to protect public health now and in the future. Next slide. So I don't think we're going to skip questions at this moment just to make sure that we stay online. So I'd like to actually now turn to, I think Daniel Boos is going to moderate this panel discussion for us now. And we're going to hear from our partners and who have been working on the ground and advancing this clean air agenda. Over to you, Daniel.
Thank you, Heather. Thank you, colleagues. It's a pleasure to be here with you once again. Following the very successful Cartagena, Colombia meeting, where we were all together and with many of the partners and countries that are here listening to us today. We had in our original plan to listen from Colombia. Unfortunately, they are having some problems with the connection. So I think we'll move along with the program and give them some time trying to connect. But we can tell that it was a very powerful meeting in Cartagena with the presence of the president of Colombia, showing the high-level commitment from the country, the Ministry of Health, the Ministry of Environment, and we had over 210 participants from the region of the Americas in Cartagena in March this year. which shows the importance of this topic for the region of the Americas as well. And that's why I think it's great to have this joint event between all levels of WHO today. So moving along with the program, I would like to invite Mr. Leonard Ted, Deputy Head of Department of CDO, Foreign Commonwealth and Development Office. Yes, I can see you now, Leonard. So very warm welcome to this webinar. And we do have a few questions, if you can elaborate and help us with these topics. So how does the UK integrate clean air and health priorities into its national and international development agenda? And what steps are being taken to ensure that UK support drives long-term solutions in countries most affected by air pollution, and ultimately supporting the targets that is aimed in these events and in this whole movement spearheaded by WHO and many partners such as FCDO, to decrease in 50% the health impacts from air pollution by 2040. Leonard, once again, it's a pleasure to be with you, and I give you the mic.
Thanks, Daniel, and thanks, Maria and Heather, for putting this together. It's great to continue the momentum that was so well accelerated when we were all together in Cartagena. A few remarks from the UK government perspective, which of course includes the domestic, our Environment Ministry for UK areas of work, including progress against the Cartagena commitment, but also from the international perspective as I work for the UK Foreign Commonwealth and Development Office. So, I mean, it was really a lot of progress, right, at Cartagena. So it was great to be part of that, and seeing how that was followed up at the World Health Assembly, that we are all collectively working towards this 50% reduction in the health impacts of air pollution by 2040 really gives a sort of sense of collective target, progress, each of us working jointly towards something collectively. And then from that, it's interesting, some of the questions in the Q&A already, that triggers then consideration around in which areas of the priorities, which will be different in different places, around regional cooperation or subnational or different elements of the really tricky set of issues involved in action on air pollution. So, but it is really clear that the health sector has an essential role to play in securing progress in bringing the evidence to the table and offering solutions and working with partners from across such a range of organisations to help delivery of this headline target, the 50% reduction. So a few things to say from the UK perspective. I mean, the first is that we're really interested in international cooperation and partnership. The UK has been a leader in prioritising clean air. This was referenced many times in Colombia, from having the first Clean Air Act in the 1950s through to being proactive in cooperation in the region. And so the commitments and the actions to deliver on those builds on a great depth of academic and historical UK engagement. So the specifics against what we committed to in Cartagena, which under the headline of support for progress to reduce by 50% by 2040, some of the early activities that we are doing include that this year, the UK will publish an updated, revised environmental improvement plan. This is to help meet ambitious Environmental Act, the legislation targets, and this will include a prioritised plan for environmental outcomes, including air quality within that. The government's developing interventions to reduce emissions. It's interesting in the sort of different areas which are particular problem ones. So we're looking at domestic burning, so solid fuels in the urban environment to improve air quality, and evaluating options to reduce fine particulate matter related to domestic burning. So that's a very current one. And reforms to industrial permitting and some of the regulation related to key pollutants in industrial sectors. Some of the guidance is updated, and so the Environment Ministry DEFRA for the UK is updating those regulations. Another really big one, and this I think goes for all of us, is how this is communicated. So the UK government's considering changes to how the risks of air pollution are communicated to the public. So that we've held a comprehensive expert-led review, but this is my personal perspective, is that air pollution is something that citizens really engage with. Increasingly available personal monitoring, but uptake when there are different levels of air pollution alerts, and in different environments, in school environments, in indoor, outdoor. It's the tools that all of us have on our phones. It's something that concerned individuals, concerned parents, can really get very personally involved with helping individuals make informed choices, and then the democratic engagement and accountability that individuals take to support actions at so many levels: local, community level, subnational level, city by city, and the national changes that are needed to protect everyone. So that sort of concludes the sort of domestic piece. In the international domain, the UK Prime Minister has been clear that climate and global health will remain key priorities for the UK. The Clean Air Agenda sits at the intersection of climate and global health, so we're in a strong position on that. When we were in Colombia, and this was featured in the short film, the Climate and Clean Air Coalition is an important partnership for cooperation and delivery, particularly on the non-CO2 pollutants and health-related perspectives on that, as well as climate forcing. But the UK is now the co-chair of the Climate and Clean Air Coalition, and we're looking forward to co-hosting the board of that in London next week as part of London Climate Action Week, part of the sort of drumbeat of climate action processes throughout the year. But there'll be a good element on air quality within that, associated with what will become what is a formal role that the UK has as the Climate and Clean Air Coalition co-chair. That's at ministerial level. We have what else could I draw on? Could I mention? So some of the other things that we committed to in Colombia relate to supporting particular elements of cooperation. So some of this is in the information and policy and making sure the right people have the right information, which would include the Air Quality Management Exchange platform. Heather mentioned the science and policy summaries. So we're really glad that there'll be a launch event at the UN High-Level Political Forum of these. So we hope that that will, in very concise and prioritised format, reflect on what some of the key interventions to help meet these targets are. And also we've been funding we moved to fund the Africa Clean Air Programme to support initiatives in the Africa region. I think that's probably, I could go on, but just to conclude, I would say that we really felt that the Cartagena conference was a milestone event. We really welcome and appreciate the government of Colombia and the World Health Organization in convening it. It raised the bar in terms of ambition and cooperation. We know in the European region how important dialogue and cooperation is on action on the health impacts of air quality, and we look forward to continuing to play a key role in supporting this effort. Thank you.
Thank you very much, Leonard. Amazing. I took some notes on the improvements of governance, regulations, enforcement, communications, public engagements, work at local level, amazing work all over the board, nationally and also internationally, supporting the clean air agenda, strong agenda, important agenda, the CCAC engagement, and all these high-level political movements that are happening. So amazing that we can count on the UK's support for the achievement of these ambitious goals. So now let's see if I can pass. I believe that now we have Colombia online. Lina, can you confirm that you hear us? Maybe not yet.
Yes.
So I believe we'll move along. And Lina, if you can connect, or we can test your mic, and then we can give you the mic once we go through the next presentation. So we guarantee that we keep the event moving. So now it's my pleasure to invite Thomas Henriks from the European Commission. Thomas, can you hear us? Now I want to check with everyone.
I can hear you well, and good afternoon, morning, or good evening, depending on where you are following the discussion. And thank you for inviting us to be part of this webinar. And I'm joined here by a colleague, Philip Molen, and we, I think, would want to give you an update on where we are with our air quality policy and approaches to improving or reducing the exposure to air pollution in our region. I would like to share a slide or two to that effect. I'm wondering if I will be able to do so. Let me see. Please bear with me. I hope you see a blue slide now, and I'm going to pretend you do and just keep talking. So what I would like to do is, first of all, say that we are working towards a target that is already kicking in 2030. So we have a zero pollution action plan target, as we call it, to reduce air pollution by 55%, or the exposure of people exposed to health impact by air pollution, measured as the number of premature deaths attributed to PM2.5, by 55% between 2005 and 2030. And as we're moving closer to 2030, you can see where we stand according to the latest data towards achieving this. And what we assume currently is that in 2023, we did quite a big step along that way with minus 45%. So there's still a bit to go, but the trajectory looks promising. So we're hopeful that we have everything in hand to get to that 50% or 55% reduction target by 2030. This is not just a question of the EU as a whole doing this. This is, of course, also looking into whether the member states in the European region do so. And you can see in this graph, which is rather full, and I'd like you not to waste too much time to understand it in all detail, see that we have for each member state a comparison between the data for 2022 and 2005 on the left-hand side in orange and green. On the right-hand side, you can see what this translates to into percentage change between 2005 and 2022. And you can see that for most member states, this is in the category between minus 25% to up to above 90%. So there's something that is happening, and that seems to be delivering some results. And maybe for context, for those of you that are not part of the European discussion, a quick overview of what that means in practice. We have a so-called air quality directive, which sets air pollution concentrations and a monitoring system for 12 pollutants. So according to that, we aim to achieve those as maximum levels across the territory of the Union. But this is, of course, only measuring the state of air quality. In the bottom, you see what delivers the reduction in air pollution. So on the one hand, we have the so-called National Emission Reduction Commitments Directive, the NEC directive, which sets national emission reduction targets for sulfur dioxide, NOx, volatile organic compounds, PM2.5, and ammonia. And we have a range of source-specific emission standards for industry, for household devices and for transport devices. So this is how it all comes together. And recently, meaning in 2024, we have updated our air quality directive, which is the setting the standards, to not only set standards that are more closely aligned with the WHO recommendation to be reached by 2030 and a zero pollution objective by 2050, but we also brought in new metrics, and I'll come to that in a second, to reduce the average exposure. We've brought in elements, stronger elements, to improve governance and enforcement, which will include a regular review mechanism and strengthens the role of air quality plans to improve air quality, to make air quality measures tangible and more effective. This comes also with an improved enforceability, meaning we have strengthened or clarified rules that come to access to justice, compensation, and penalties where the measures taken do not live up to the requirements. We also add elements to the transboundary cooperation because, of course, in the European continent, we do see pollution travel from one country to another. We have strengthened the monitoring requirement because we do have a good monitoring network with 4,000 monitoring stations, but we also know that increasingly air quality modeling can deliver information at the same, not quite the same, but with some level of detail and with similar level of certainty. We also introduced new pollutant requirements for measure requirements for emerging concern pollutants such as ultrafine particles, black carbon, and ammonia to see whether or not there is standard setting needed for those. Finally, and our colleagues from the UK already mentioned this, there's an effort on enhancing the information and the communication with citizens so that it is clearer for everyone to understand what is the air quality they are exposed to and what does it mean for their health. I mentioned the standards before, and it might be useful to show where we stand. Again, a complicated picture, which I'd like to just highlight 3 elements on. You see the pollutants that are in the directive, so there's 12 of them. In light blue, you see the annual recommendations by the WHO. So for PM2.5, that is 5 micrograms per cubic meter. For NO2, that is 10. In dark blue, you see where we were where we are currently in our standards, and we have taken in Europe the commitment to improve or to strengthen these standards by to 2030 into the light blue to the middle. So you can see that we are taking a step towards 2030 to come closer to what the WHO has recommended. In addition to that, we introduced something called the average exposure reduction obligation, which means that member states in every consecutive 10-year time window will reduce or will aim to reduce at a regional level the average exposure of their population to PM2.5 and to NO2 by between 10% and 25%, as long as they are above the WHO guidelines. So there's a stronger ambition level now set to make sure that we keep this momentum of the improvements we've seen in the past. I'm going to skip the next one and just mention that we are also in parallel looking at a review of the National Emission Reduction Commitments Directive. So the directive that sets the number of percentage reduction member states have to achieve for these 5 pollutants I mentioned before. This evaluation will look at the effectiveness of the policy, at the efficiency of the policy, at the relevance, at the coherence, and the EU added value. And we'll be happy to share the slides. And if you click on the word website, you will get all further information to this effect. We've produced a cleaner outlook that underpins the data I showed to you in the beginning. So you don't just have to take my word for the efforts made and the successes had, but there is a detailed analysis that looks into the progress towards meeting the 2030 emission reduction commitments by different member states, but it also puts clearly the numbers on the paper, whether we and how we are on track to reduce by 55% compared to 2005 the number of premature deaths attributable to PM2.5. It is less likely that we meet the ambition we have set ourselves for reducing the ecosystem area where air pollution threatens biodiversity by 25%. So there is a bigger challenge that we still have to address. I'd like to end with two slides as a concluding reflection. The first one is because you were keen to understand what our plans are going forward. So the Air Quality Directive entered into force in 2024. We will be producing a number of technical support documents as regards monitoring and modeling. Those two have already been published, and as on the role of natural sources and winter sanding and a couple of other implementing acts. We will be hosting a Clean Air Forum in the second half of this year, by which time we hope that the evaluation of the NEC directive is available. And then towards 2030, member states will have to first transpose the directive that has been agreed and adopted at European level and set in place their first air quality roadmaps and their annual reporting of the extended monitoring regime, so that by 2030 will hopefully be a large step forward towards meeting these more ambitious limit values. As a concluding slide, I'd like to maybe just stress something that may be obvious to us, but not to everyone. Clean air policy works. Fundamentally, investments into clean air policies pay off. We've seen major improvements since the 1990s, and these improvements have not been limited to a specific time period. We have seen continuous investments and then continuous improvements, and this has not come at the expense of the economic development. We have the ability to understand very well what the air quality is like by having in Europe 4,000 monitoring stations and air quality modeling that allows us to see not only the concentrations at the stations, but also in the area around them and across the territory. So we have robust, comparable, and harmonized data, which helps, but is not needed to take action per se. So I don't think that the lack of monitoring data where it's not available is something that would hinder action to be taken, but of course it helps making these actions more measurable and smarter. We see that implementation, governance, and communication is key to bank these processes, and we see that we have put in place a lot of EU funding that affects clean air. This number, 185 billion over the 6-year period that I mentioned, is a big number, but if it also includes elements that are not immediately identified as clean air measures, but that relate to measures taken in other sectors that have a clean air benefit. And if you add all of that up, there's actually a lot of money available across sectors to improve air quality and to not take decisions that decrease air quality. We do realize that some regions within the EU and outside the EU have a bigger challenge than others. And we have to say that even for those within the EU where the challenge is greater, we've seen striking improvements. So there was no member state you saw where we didn't see a significant decrease in the number of people exposed. And finally, we expect that when the Air Quality Directive is fully implemented by 2030, it will render significant additional health, social, environmental, and economic benefits across the EU. So we hope that this is useful for your discussions. Maybe some of these elements are useful for your respective communities or neighborhoods. Thank you.
Fantastic. Thank you very much, Thomas. I think we are here. I'm here today in Barbados. We are discussing the new Caribbean Action Plan on Health and Climate Change with Ministers of Health, Ministers of Environment. Air pollution is increasingly an important issue also for the Caribbean nations. And I think that all that you said resonates a lot to this region. I would stimulate that we can continue the dialogue and maybe promoting a dialogue between European countries and the European Commission and CARICOM countries. And you said monitoring and investing in clean air works, and cleaner, healthier, and more sustainable environment and peoples. So thank you very much for your powerful intervention. Let's see if I mentioned that I'm in Barbados. Let's see if I can go to beautiful Colombia again. Lina, can you please confirm that you hear us?
Yes.
Excellent. Gracias, Lina. Lina, thanks so much for the leadership of Colombia in hosting the Cartagena Global Conference on Air Pollution and Health in March this year. It was an amazing event. And given Colombia's leadership role at that second Global Conference on Air Pollution and Health, how is the Ministry of Health building on that momentum and to advance national clean air policies and to reduce the health impacts of air pollution by 50% by 2040. So can you tell us a little bit of the Colombian experiences? And thanks again for joining.
Thank you. Thank you, Daniel. Good morning, everyone. Receive a cordial greeting from Mr. Hear me, Daniel?
Yeah, we can hear you very faintly. So maybe if you can approach to the mic, and also the presentation, we don't see that in presentation mode. If you can put that in presentation mode.
Okay. Good morning, everyone. Receive a cordial greeting from Mr. Vice Minister Jaime Orrego. My name is Lina Guerrero. I am a part of the Environment Health Subdirection at the Ministry of Health of Colombia. In this opportunity, I would like to share some important aspects regarding the next steps after WHO's second global conference on air pollution and health. How is the Ministry of Health leveraging this momentum to drive national clean air policies and reduce the health impacts of air pollution by 50% by 2014? Colombia's Ministry of Health is taking advantage of the opportunity generated by the second global conference on air pollution and health to strengthen national clean air policies and reduce public health impacts. Some key strategies include integration of air quality and health into the National Development Plan. Through Colombian state commitment, strategies from the health sector are being strengthened to implement the National Development Plan. These include measures related to the energy transition and its co-benefits that contribute the reduction of air pollution and greenhouse gases emissions while improving health outcomes. Intersectoral coordination. The conference reinforced joint action among the health, environment, transport, and energy sectors to reduce the impacts of air pollution in the country. An action plan through 2026 was developed to promote monitoring system aimed at assessing the impact of air pollution on respiratory and cardiovascular diseases. Strengthening response capacity within the health sector. As a result of the conference, efforts were made to enhance primary care capacity through the implementation of basic health teams. These teams directly reach the most affected territories, enable preventive and promotional health action in response to air pollution impacts. The basic health teams strategy is expected to play a key role in the early identification of respiratory, cardiovascular, and other adverse health effects linked to air pollution, while also ensuring care in rural areas and vulnerable communities where environmental impacts are most severe.
Lina.
Integration of the climate change agenda with commitments made on the Air Pollution and Health Conference. Meeting air quality targets contribute to the reduction of greenhouse gases, generating not only health benefits by reducing diseases burden, but also economic savings for the health
Lina, sorry, we can't see your slides. They're not changing. Can you put in presentation mode, please?
Okay. Yes. Can you see presentation or not?
Yes, it's not in presentation mode, but yeah, at least we switched slides. Okay.
Okay. How are you ensuring that health remains central to air quality action across sectors? Air pollution in Colombia is a major concern due to its significant impact on public health and the environment. Cities such as Bogota, Medellin, and Cali face alarming pollution levels, which is why policy instruments are in place to ensure that the action of various stakeholders aim to reduce the health impact and other social determinants of health. For example, the 2022 and 2025 National Development Plan of the current government, the National Air Quality Improvement Policy, the 2022 and 2031 10 years Public Health Plan, and the National Fire Food Substitution Plan, along with climate change policies tools, all aim to reduce the emission of short-lived climate pollutants like carbon. This effort contributes the Colombians' NDC targets and yield medium-term health results, especially concerning cardiopulmonary diseases. Finally, all of these policy are current, and these are aligning with the Sustainable Development Goals and are currently being implemented through the National Intersectoral Technical Commission on Environment Health, specifically within the Technical Work Group on Air Quality and Health, in which all sectors are involved. Thank you, Daniel. Thank you, everyone.
Muchas gracias. Thank you very much, Lina, and thanks for the leadership of Colombia in advancing with these efforts. Thanks again for the hosting the second global conference on air pollution and health, and we look forward to continue to engage with Colombia and learn from Colombia on the efforts that you're doing to improve air quality and save lives. Now we move to C40, Alejandro Colza Perez, head of Breathe Cities. C40 has always been a leader in advancing city-level solutions. We saw in Cartagena as well the relaunch, so to speak, of Breathe Cities initiative, empowering urban leaders to implement bold clean air actions. And our question to you, Alejandro, is what evidence have you seen on these efforts of translating into health benefits for city residents? And give us some examples of cities that got actively engaged in air pollution and health actions in cities. And which recommendations can you give to cities who are interested in following these beautiful movement that you guys are co-hosting with WHO and others of Breathe City? So Alejandro, please go ahead. The floor is yours.
Thank you, Daniel, and good afternoon, everyone in Geneva and Geneva time zone, but also good morning, evening, everybody who might be in different parts of the world. My name is Alejandro Colza. I am the head of Breathe Cities at C40. I wanted to first thank Maria, Heather, and the team at WHO for the opportunity to join this important conversation and ensure that we can highlight the clear role that cities play in advancing action on clean air and commitments for health. Just for those, before I start on those questions, for those that might not know, C40 is a network of mayors, nearly actually 100 of the world leading cities collaborating to deliver urgent action that is needed right now to confront both the climate and the clean air crisis. Together, all these cities to create a healthier future for everyone, where everybody can thrive. We're actually all over the world. Our combined population, it's over 600 million residents, 27% of the global economy. And if you add residents, commuters, over 900 million people are impacted by the quality of the air in our cities. So this is massive. And the action that we have in our cities can really have an impact on millions of our residents. And how C40 do this is we have three key missions. One is to help halt climate breakdown by halving fossil fuel use in cities by 2030. We also want to increase resilience so our cities and our people can really be protected as they face the impacts of this breakdown that we are suffering at the moment. But also very important, we want to make sure that this transition is clean, is green, and is fair, so that everybody that has these negative impacts of clean air, air pollution and climate can really benefit first, because they're the most vulnerable populations that are the most impacted. So what does this look like for air quality specifically? So at C40, we have a tool called the accelerators, which is the main tool to drive ambitious actions in our cities. Since 2017, C40's accelerators have really helped the cities to meet science-based targets. We currently have around 10 accelerators supporting our almost 100 cities. But for today, the most important one for us is the Clean Air Accelerator that brings together ambitious mayors to improve air quality and bring them in line with World Health Organization's air quality guidelines. For us, it's very clear and important that WHO guidelines are those that we need to help our city go towards, and that we want to help them contribute to accelerate their reductions. So our accelerators provide that framework to ensure that cities can measure their pollution levels, they can set clear science evidence targets, they can implement effective policies, but very importantly, that they can report progress in a standardized and a transparent way across our cities. So far, what are some of the progresses that we've seen in our cities? Since 2018, clean air accelerated cities have seen a 6% reduction on PM 2.5 levels and 11.4% reduction in NO2 levels in those signatory cities. And in the slide, you have a long list of different areas where there's been action. I'll just highlight a few. For example, we have 42 cities that are expanding their air quality monitoring network. And Quezon City in the Philippines, for example, is a great example of the city implementing the first air quality monitoring network, around 40 sensors in the country, that is really improving the availability of air quality data, particularly looking at those vulnerable communities. We have 43 cities committing to work to electrify their transport fleets. So, for example, Delhi is on track to electrify the entire bus fleet. And for example, already 1,900 of their compressed natural gas buses have been already replaced with electric buses. And this is contributing to massive reductions in the city. And I could not mention the case of cities that are implementing urban vehicle access regulations, such as in the city where I live, London, where, through the last years, Mayor Khan has been implementing a very ambitious ultra-low emission zone that has seen reductions of over 50% of air pollution in the city, and is having an incredible impact also as well in those hotspots where the most vulnerable live. So there are loads of examples across different areas, but I know I only have 10 minutes, so I will move on to, what it's next. We came to WHO, and it was incredible to receive the invitation to come and showcase the importance of local leadership. We have in the center the picture from Mette Coburn, Deputy Mayor of London for Environment and Energy, who delivered a statement on behalf of the co-chairs of C40, Mayor Sadiq Khan from London and Mayor Aki Sawyer from Freetown, that welcomed the WHO new roadmap and also reaffirmed the role of mayors driving the cleaner solutions through the accelerator and through programs such as Breathe Cities. We also hosted a cities forum where local leaders that came to Cartagena discuss how they tackle air pollution and the role that they play on working with national level governments, with the health sector in driving this change. We published analysis on the health and economic benefits on what happens if cities meet WHO roadmap. And we also have an opportunity to provide standard visuals throughout the conference on how air quality action and positive action in cities is having a great impact. We have a cleaner corridor. We had the long visual video in the wall. So it was really an opportunity to give cities a voice throughout the conference. So what are we committed to do next? C40 has committed to continue to work alongside cities to reduce air pollution and achieve the roadmap objectives by raising the city ambition through our targeted programs. Of course, we have the accelerator that I've mentioned. We also have technical support from programs such as African Cities for Clean Air, Bloomberg Ideas Exchange. We have a large peer-to-peer network support with our Clean Air network. And of course, I couldn't stop a presentation without talking about one of our flagship programs that I head up within C40, which is Breathe Cities. So Breathe Cities is a $30 million initiative that it's delivered in partnership between C40 Cities, the Clean Air Fund, and Bloomberg Philanthropies. And we're focusing on supporting urban leaders with the bold, cleaner action that they need to take in order to accelerate reductions. We hope and have an ambition that by 2030, we will have a 30% reduction on air pollution based on 2019 levels. And we do that by a combination of empowering decision-making through data, by empowering our communities and stakeholders so that they are equipped to demand ambitious actions. We equipped our policy makers so that they can deliver the technical support that the cities need. And we also have a key aspect on knowledge sharing to make sure that the cities are not in isolation, but actually they're working with each other, they're learning from their mistakes and learning also from their failures. And even though the program has only been around for a bit over a year, there are already key aspects of success that we are already see. And, based on your question, I want to focus on specific things linked to health. Accra and Nairobi, for example, in addition to those policy interventions to tackle emissions, we are supporting them to install the country's first networks of low-con sensors that are going to monitor and report key valuable data for the health authorities so that they can track pollution levels, identify the areas of concern, and also inform public health interventions. In Jakarta, where we are implementing the program with our colleagues in Vital Strategies, we are delivering air pollution training to over 120 frontline health workers. In Brussels and Paris, in Europe, our program is supporting the rollout of school streets. And we know from evidence, for example, in London, how school street helped to reduce around 23% of pollution when there is a school street in place. And they also make it safer, walkable, which also has the co-benefits on better exercise and more active life for the children attending to school. In Johannesburg, in South Africa, last year during Clean Air Week, we co-hosted events with health officials, clinics in one of the key townships in the city to ensure that we're linking air pollution to respiratory illnesses and to elevate air quality as a public health crisis, not just as an environmental one. And all this awareness has been key for the city to conduct a survey that is going to measure the perceptions of air quality and clean air measures in the city that will then inform the ambitious action that we are supporting through Breathe. In London, we have a key collaboration between health departments, city academics institutions to develop the first UK air pollution alert system for health professionals. This means every time there's a pollution alert, 24 hours before, the GPs and emergency departments receive an alert. And this is vital to the provision of timely advice and guidance for citizens. So I want to end highlighting the importance of putting our cities at the center of advancing action on clean air commitments and health. As Heather said before, even though this roadmap has, one of the key focuses is on member states, many others will have to play a role. And cities can be your best ally. both when aligned with national governments and priorities, we can help accelerate the action better, but also, and more importantly, when sometimes cities and national governments might not be eye to eye or following the same direction of travel, cities can really be leaders and can be the islands of hope where sometimes national governments are not racing to the challenge. So it's important that we are supporting those local leaders that are really wanting to go above and beyond. And in terms of recommendations that you were mentioning, Daniel, I think it's just important both for cities, but also for partners in this group, that it is important that we help our cities make health visible. We need to frame air pollution as a health crisis, not just as an environmental one. We need to engage health champions, bring doctors, nurses, public health leaders into the conversations with city leaders. They really can be trusted messengers, especially when there is backlash. We need to collaborate on data, make sure that our health institutions are partnering with our air quality data collectors so that we can make sure that those impacts are measured and communicated. And finally, like we've seen in London, let's integrate clean air into our health systems so that we can make sure that health departments can include air pollution in their health messaging. It has been super successful in London and it can be so elsewhere. So here at C40, we remain committed to continue working with partners, including Maria's team at WHO, so that cities and C40 can have a clear role to play in help realizing and monitor and report progress on meeting the new WHO roadmap. And I'm looking forward to that collaboration. Thank you.
Fantastic, Alejandro. Thank you so much for your powerful intervention as well. You highlighted it all again, the importance of local level where people live in the cities, in territories, and the engagement of mayors and local authorities, but also the communities, also who is being affected the most by these problems, to have a voice to be able to help designing, monitoring, and assessing the interventions that are being taken place and restructuring them as needed. So the energy transition is clean, fast, and fair, most of all. So thank you very much for highlighting all these important topics. Now we move to the final part of our webinar with a special guest, Alexios Fotios-Mentis from Greece. Alexios, thank you very much for joining, and please share your overview on Greece's efforts to tackle air pollution, especially in the transport sector. Please go ahead, Alexios.
Thank you so much for the kind invitation. Thank so much, Maria, for having brought me into this panel. First of all, I'd like to extend the apologies of a good friend and Minister of Transportation who was not able to attend today due to some previous commitments. So I'll try not to keep you busy and to be as brief as possible. Greece is a small economy, and in that sense, it does not represent a major threat to air pollution. As far as I know, and I'm not talking only as a public health officer at the National Public Health Institution, Greece has been fully committed to all international guidelines regarding air pollution, and it has also built some national energy and climate plans so that it enables the country to mandate zero fossil fuel electricity by 2028. There is also a new national climate law to commit to 55% emissions cuts by 2030 and reach carbon neutrality by 2015. There has been also major emphasis on ending lignite-fired power by 2028 and to decrease its percentage from 60 to 10%. And there have been also some incentives regarding island interconnections with cleaner energy, because as you know, much better than that many people, Greece has a lot of islands, and it does become complicated when these territories should be addressed. Now, regarding your focus on cleaner transportation, I think Athens has been suffering for many. It's extremely urbanized, and the Attica region has been suffering by its combination of a humid and hot environment. It's been suffering for many decades from gas emissions. It seems like the quality is gradually improving, but I'm not sure if there are any truly major effects that are taking place. But that said, I'd like to point out some issues regarding Greece. For example, there has been a decision that all petrol and diesel vehicle sales should be ceased by 2035 in accordance with the EU regulations. One of the particularities of Athens region has been the so-called dactylus driving restrictions, which is an alternate day play bans in city centers to reduce the peak period pollution. Regarding the underground stations, which is an excellent alternative to using cars, practically only Athens has been the only region who has applied on the underground station, and I think Thessaloniki, which is the second major city of Greece, has its underground station working for the last 1 or 2 years. When it comes to the connection between environmental health and medicine or academia, my estimations is that there's a medium-sized environmental health research in Greece. The major focus has been from the University of Athens Medical School. As far as I'm aware, the Hellenic Center for Disease Control, where I'm working, there seems to be no dedicated department for environmental health. There seems to be a medium-sized department for non-communicable diseases, but I think nobody is truly committed to addressing the connections between health and environment, which is an issue that might raise the alarms for WHO to inform countries to build environmental health departments. Also, as far as I recall, there's no specific course at the bachelor's level for medical students to appreciate the importance of environmental health. And last but not least, there has been a WHO, the World Health Organization's country office in Greece since 2019. I'm not sure, though, if there have been any specific initiatives on environmental health. And I would like to complete this mini presentation by recalling what I've learned from a rather famous epidemiology professor who was teaching in Athens and at Harvard. We should never forget that mitigating air pollution may have a much bigger total impact on public health in life years saved. For instance, 10 million life years if we tone down the limits of the particular matters, than cancer treatment, despite smaller individual effects. So working on air pollution might be even more important than treating cancer. And I look forward to joining these efforts and to have Greece being more interconnected with WHO towards this agenda. Thank you.
Thank you very much, Alexios. Not Daniel, but he was disconnected, so I will do the last transition to our final speaker. Thank you so much, speakers, for all the important messages and all the interventions you've made. And let's continue our joint tackle, our joint fight against air pollution and protect the most vulnerable populations. Just to let you know, before I turn over to Jerry, we will, together with PAHO colleagues, send you a follow-up email with the recording, with all the slides, and with those answers to those questions which were not responded online. We will do a small list and get you some answers in the next couple of days. So thank you so much again. I will now turn over to my colleague Jerry. I guess she's also in Barbados, director in the Department of Social Determinants and Health. Over to you, Jerry, for final remarks from your end. Thank you so much.
Thank you. Thank you so much, Paul, colleagues, Maria, Heather. Absolute pleasure to have been here with you. I've had the same internet connection as Danielle, so I hope I'm not going to be disconnected, only having seven times during this webinar. It's a great place to be, but internet could use a little bit of improvement. But colleagues, thank you. Thank you. This was very, very Interesting, very inspiring. Thanks for WHO. Of course, our mother organization, as you know, the Pan American Health Organization, is both the regional office of the World Health Organization, but also the oldest health organization as part of the Inter-American system. So very, very pleased to be here with you and to just give a couple of closing remarks. Thanks for the speakers. Was fascinating to hear from all of you, for all of you who are participating, who are listening, who are thinking about what to do next, and most of all, for all of you making this difference, the difference in the lives of people, in the health of people, in the well-being for everyone, and really, by addressing this huge threat that air pollution puts on the health of peoples. So thank you very much, the UK, for your insights. Colombia was also hard connection, but great, and thanks again for your leadership during the conference. The EU, I really loved your comments on that clean air policy really works, and we know enough to act. I think that was also very, very powerful. C40 really highlighting the importance of working at local level with cities, because that's where many of the things really move. Greece, thank you very much for your
welcome.
It's clear we can, together with all those different interventions, with all this energy, meet this global goal of reducing 50% of the health impact of air pollution by 2040. It's possible. So in the Americas, this is unfortunately the region that is most unequitable in the world. But we're working very hard with WHO to contribute to this global goal. And when we talk about air pollution and how it affects people, and we talk about vulnerabilities, of course, we know that people who have already pre-existing medical conditions are going to be more affected, that children and the elderly are feeling the impacts more, but also in terms of those people living in those conditions, in those situations, in those territories of vulnerability. It's really important, and we put a lot of focus on that in the Americas, thinking, for example, about the indigenous communities that are still cooking, with polluting fuels in their homes, where their children play, live, where the women cook, etc. So these are communities where we really need to put focus. And also in the large cities, we know that the people who are most affected, that live in the areas with most pollution, are usually already the disadvantaged, the poor, the migrants, etc. So it's very important, and we do this in the region, and we love to work also with others to strengthen this focus on those populations in vulnerability. In the Americas, we have made big progress. We have last year also the adaptation of the regional policies on climate change and health, with the focus on health equity. We do a lot of capacity building on AirQ Plus through our expert group on that. We are working with countries to strengthen epidemiological surveillance. We work with countries to use the co-benefit estimate tools, to support them in updating air quality regulations that are aligned with the WHO guidelines. We have a special program. It's called the WHO for the PAHO Elimination Initiative, where we aim at eliminating 30 diseases and conditions, going from malaria, trachoma, TB. But there's also one of those elimination targets is to eliminate polluting household fuel use. So this is very high on the agenda of our region, of our regional director. We also work a lot with cities, with communities. We have a network in the Americas where more than 4,000 local governments, mayors from community, from municipalities and cities are connected. So we think we have a huge opportunity there too. We love to connect further with C40 on that. So what's really important here? We hear, first of all, there is a commitment. We have a collective goal. There is, so many good experiences that are already happening with a strong leadership from our WHO office. and all those partners that work around that. We've seen, that through partnerships, through focused action, through using science to move action, through intersectorial action, having health at the table, having health play a leadership role. As we hear, it's still not always the case. Using the argument, the health argument properly. We also see that in climate change, but it's the same for air pollution. It's the argument, as Maria always tells us, and it's correct. It moves mountains, but also to work at local level with our cities authorities, with our local authorities, with the communities, and all that makes it possible, to move ahead and to really reach the target and put in the center of our work the improvement of health of everyone, leaving no one behind, and really making sure that one of those biggest risk factors that we all, face, and where that are one of the most important factors that affect our health, our life, our well-being, and health equity, that these are being tackled. So thank you again so much. Count on us, count on WHO. We are together in this work that is going to make a change for everyone. Thank you so very much.
Thank you, everyone.